Patrick is a 78-year-old male patient who has worsening left-sided heart failure and chronic obstructive pulmonary disease, or COPD. He presents as fatigued with a regular cough. He also suffers from dyspnea. Patrick's legs are swollen from the knee down and he walks slowly. Currently, his observations present a blood pressure of 135/85 millimoles of hemoglobin and a heart rate of 155 beats per minute. Furthermore, Patrick's body size measurements are a weight of 95 kilos, height of 180 centimeters, and a waist circumference of 104 centimeters. Patrick smoked from the age of 20 to approximately 60, quitting smoking in his early 60s. At the age of 68, Patrick experienced a myocardial infarction to the branch of his left coronary artery. The results from his fasting blood test include:
Patrick's respiratory symptoms can be attributed to both modifiable and non-modifiable factors. Currently, his symptoms are a regular cough and dyspnea, which are identifiable clinical features of emphysema and chronic bronchitis, the two subdiseases of COPD, as well as a history of left-sided heart failure. Due to Patrick's previous smoking habits, a major defense mechanism within the lungs has been compromised, being the mucociliary escalator. In the airway, cilia function is vital to mediate the critical function of mucociliary clearance, cleansing the airways of inhaled particles and pathogens. Patrick's regular cough can be attributed to having a combination of excess mucus and damaged ciliary glands that are unable to move the mucus, causing the body to employ coughing as an important means of mucus secretion removal. COPD causes pulmonary hypertension as it blocks the flow of blood through the capillaries in the lungs. This increase in capillary hydrostatic pressure causes pulmonary edema. This will affect his respiratory symptoms as it will lead to laboured breathing and a cough as he tries to extract the fluid. This combination of COPD, pulmonary hypertension, and the damage to the left side of Patrick's heart suggests pulmonary edema. Pulmonary edema causes excess fluid to line the alveoli, resulting in a cough and dyspnea due to impaired lung function due to smoking. The presence of pulmonary fibrosis is plausible as a result of his 40 years of smoking, which further contributes to his dyspnea, fatigue, and cough. Additionally, Patrick's dyspnea can be attributed to his BMI of 29.3, which classifies him as pre-obese. This would contribute to Patrick's laboured breathing as his excess abdominal visceral fat applies extra pressure to his diaphragm and chest cavity, therefore compromising the lungs' ability to fill with air, ultimately resulting in Patrick demonstrating symptoms of breathlessness and fatigue. Patrick's heart rate is presenting as 155 beats per minute. This is classified as high as it exceeds the normal parameters of 60 to 100 beats per minute. This can be attributed to his history of smoking, in particular his active exposure to nicotine, which has caused vasoconstrictions of his arteries and veins, resulting in the heart having to work harder to pump blood around the body, which in turn increases his heart rate and blood pressure. Patrick is likely to have peripheral artery disease, which is evident by his increased LDL and triglycerides and decreased HDL. Patrick's hemoglobin level is low, at 111 grams per litre. This would indicate reduced red blood cells, ultimately causing complications with oxygenation. Patrick suffered a myocardial infarction and is experiencing worsening of the left-sided heart failure, which prevents the left ventricles pumping properly and providing oxygen-rich blood to the body, which then leads to tachycardia and shortness of breath. His BMI is 29.3, which is pre-obese, which causes his body to produce increased amounts of blood volume due to increased demand from excess fat. The increased demand means the body has to work harder to pump oxygen-rich blood throughout the body.
Patrick's diagnosis of COPD and left-sided heart failure have developed independently from one another. His COPD was not a result of his heart attack, rather as a result of his 40 years of active smoking. Exposure to nicotine causes damage to the alveolar walls and breaks down the elastin fibers in the alveoli, resulting in permanent air sacs in the lungs. The loss of elastic recoil causes the airways to collapse during respiration, resulting in emphysema. Likewise, chronic bronchitis causes the bronchial tubes to become inflamed and produce excessive amounts of mucus, which impedes on the normal airflow, making it difficult to breathe and cause a chronic cough. Patrick also has a left-sided heart failure, with the left side of his body unable to pump enough oxygenated blood to meet the body's needs. This was a result of his myocardial infarction at age 68. Patrick's blood pressure is high, but not enough to classify him as hypertensive, as it is only 135/85. Patrick also has other symptoms associated with his MI, including age, lifestyle, BMI, and risk of obesity and smoking. MI causes heart failure due to the adaptive measures the heart takes to compensate for the insufficient cardiac output. While COPD and his left-sided heart failure have developed independently, it is important to note that they can interact with each other. COPD causes low oxygen saturation levels in the blood, placing further strain on the heart and further impacting the strength of the heart contractions. Conversely, heart failure results in excess fluid in the lungs, exacerbates COPD symptoms, causing difficulty with breathing. Due to Patrick's current left-sided heart failure, COPD, and blood pressure, he is likely to experience right-sided heart failure. Right-sided heart failure occurs when the right ventricle has difficulty pumping blood to the lungs. As a result, fluid is forced back through the lungs, weakening the heart's right side, causing right-sided heart failure. The backward flow backs up in the veins, which causes fluid retention in the lower extremities, which we can already see as Patrick is experiencing swelling from the knees down. Ultimately, as Patrick's blood is unable to be successfully pumped through the right side of the heart, it pulls back, resulting in it flowing in the legs and causing pulmonary edema. Left-sided heart failure can influence right-sided heart failure because when the left ventricle fails, the right ventricle has difficulty transferring oxygenated blood back into the lungs for reoxygenation. This results in increased fluid pressure and weakness in the right ventricle. Patrick has COPD and low levels of oxygen in his alveoli as it causes the pulmonary arteries to constrict, causing pressure in the arteries to rise, which leads to pulmonary hypertension. This excess strain from pulmonary hypertension on the right ventricle can result in heart failure, as a decreased cardiac output leads to the activation of the renin-angiotensin-aldosterone system, which increases the mean arterial pressure, contributing to the right-sided heart failure. This rise in the mean arterial pressure can be in response to the abnormally low oxygen levels in the vessels inside the lungs because of COPD damage and the left-sided heart failure.
Patrick's potassium levels are 5.2 millimoles per litre, which is higher than normal, indicating hyperkalemia. Potassium is an important electrolyte for nerve and muscle cell functioning, especially for muscle cells in the heart. Patrick's hyperkalemia can be a result of his high blood pressure, COPD, and risk factors such as age. Patrick has low levels of calcium in his blood, and this is called hypercalcemia and can be due to renal failure, which causes more calcium to be excreted through urine, making it harder for the kidneys to activate vitamin D. Symptoms are swelling in the legs, shortness of breath, and constant fatigue, as well as causing confusion, and it is important for neurological function. Low calcium in the body could mean low albumin and could also be an indicator of liver dysfunction, and over time, poor hypercalcemia can affect neurological function. Patrick's results showed his hemoglobin at 111 grams per litre, which is low. This indicates reduced red blood cells and that he is suffering from anemia, which symptoms are shortness of breath, tightness, and fatigue. Low hemoglobin can also indicate kidney disease. Patrick's COPD and left-sided heart failure contribute to low hemoglobin, as his heart has to pump faster to compensate for the oxygen loss. Patrick's high glucose reading is indicating he is suffering from hyperglycemia. His elevated glucose can be an indicator of type 2 diabetes, which causes hardening of blood vessels. This can cause nerve damage, leading to tingling or loss of sensation in hands and feet. Patrick is at high risk of developing type 2 diabetes due to his BMI and lifestyle factors. Elevated glucose leaves Patrick at risk of developing renal failure and further heart failure. Patrick is showing elevated levels of triglycerides, which can lead to lipids building up on the artery walls, causing atherosclerosis. This can cause heart attacks and strokes, as fatty deposits can become dislodged and restrict blood flow, causing clots to form and block blood getting to the heart and brain. Patrick's HDL is low. This is concerning as its purpose is to remove the bad cholesterol, LDL, from artery walls and protect arteries from blocking and causing heart attacks or strokes. Therefore, low HDL means less protection against LDL. Previous smoking and his poor lifestyle choices have all contributed to his overall bad health. As Patrick is diagnosed with COPD, this places him at an increased risk of renal failure and renal impairment. Therefore, in addition to Patrick's previous blood tests, a blood creatinine level test would be beneficial to further assess his kidney functions as he is displaying signs of kidney disease. Creatinine is a waste product of creatine phosphate in muscle. The waste product is filtered through the kidneys, specifically through the glomeruli, and excreted in urine. It is expected that Patrick's creatinine levels would be elevated due to his kidneys not functioning adequately, which is ultimately hindering kidney filtration. From these results, the glomerular filtration rate can be calculated. This measures the amount of blood filtering through the glomeruli, ultimately to assess his kidneys' functions. As Patrick is displaying signs of kidney disease, it is expected he will have a low GFR.